Hello, everybody, and welcome back to my 30-minute mission. This is Andrea Tarowski here with Dentalelle Tutoring. I had a lot of questions again, so I'll say it at the beginning now. I may not be able to get to everybody's questions in this webinar, but I am making sure to write all of the questions down, so you will see it. I'm about a month behind because I did have a lot of questions, so I have a month's worth of videos coming up. So one every single week, and you should be able to hear your question being answered within about a month's time. So again, I'm sorry that I'm not able to get to everybody's questions right away, but if it was something super important, then you did probably hear me or see me email you back anyway. Because today what I want to talk to you about, because I did have a lot of questions on the professional portfolio. So a lot of you who were emailing me are saying, Andrea, I'm a new hygienist. This portfolio is making me nervous. What the heck? Please help us. So I'm just going to talk about it a little bit here for you. So in a nutshell, the portfolio is something that every single dental hygienist, at least in Canada, at least in Ontario, we need to maintain a portfolio. So we need to have 75 hours over 3 years, and those 75 hours could come from taking a course, taking courses, half a day, full day. That could happen from reading certain articles online, from reading articles in a magazine, even taking a course in school. That is possible to add up to those 75 hours over 3 years. And another important note is 15 of those hours don't have to be related to your goals. So I do explain this more in my portfolio workshop. If that's something you are interested in, you should sign up for it because it makes things a lot easier for you. In fact, what I can do is I can pull it up. I can pull up the information page for you on the website, but it just makes things easier for everybody. So I help you all stay organized. Actually, to make it an easier link for you, it's just at dentalelle.com workshop. And then I do explain it more. I explain what's included. So I just help to keep everybody as organized as possible because a lot of people think to maintain those 75 hours over 3 years, that's a hard thing to do, but it's not that hard. It's just the key is to be organized. I hear and see a lot of people who tell me I've been audited, but I haven't kept track of anything over the past 3 years, or the past 2 years, I should say. So help me, because if you're audited for 2017, you are told in 2016. So you do have that whole year to write the portfolio, and that whole year also you can take the time to make sure you have enough hours. So to make sure that's been taken from courses, from reading articles, from reading textbooks, whatever helps you and your practice. So the portfolio workshop, I give you examples. I give you free webinars every single month. This month, actually, there's a lot. I think there's 4 free webinars. Next month, I plan to do 2. So you will have a lot of hours, even only from that. So if it's something you're thinking about, you should sign up now because it's good for the whole year. So hey, you might as well, right? But um, a lot of people also ask me, so how am I able to make note of all of the hours that I have, and then how do I say how that helped me and my practice? Well, it depends on what your goal statements are. And you could have 2 per year, you could have 3 one year and 2 another year. There's no set number. I typically have at least 2 a year. I had 3 in the 1 year. Having that said, though, I also had only 1 for last year because I was in school for restorative hygiene, and that was at least 240 hours. So I'm good. I'm good for the next 3 years, absolutely. But if I said that that's all I did in 3 years, the CDHO would probably say to me, okay, you have enough hours, that's fine. In fact, you have more than enough hours, but you need to be doing something else too, because your portfolio shows them you are learning, and the portfolio shows them you actually like learning and would like to be the best hygienist possible for your patients. So if you're not learning too much, or you're just sort of doing the bare minimum, that isn't looking good on them either. So something else to keep in mind. So the portfolio is something that everybody has to do, although you do have options now. So I shouldn't say that's something everybody has to do. In fact, I'll show you guys the options. I talked about this in the portfolio workshop webinar a couple weeks ago, so I'm just going to quickly skim it over for you. They talked about it in the newest edition of the magazine, so let me just kind of show you guys. I didn't think about explaining that until now, so that's why I didn't have it prepared. I apologize, but I know exactly where it is. So you actually do have other options. So if you do have to maintain, or to hand in, I should say, your portfolio, you do have options now. So these are the options here. So option 1, 2, and 3. So option 1 is to hand in your portfolio. So that is 75 hours over 3 years, having to make a note of all of your learning activities, and you have to fill out your practice profile, which is easy. It's a checklist. It takes maybe 10 minutes, 5 to 10 minutes at the most. That's it. It's easy, easy. Or option 2, you could choose to take the exam, which, if you're a new hygienist, this may not scare you too much because you took the exam not too long ago. But you also probably won't be audited right away, although I shouldn't say that. You might be. It's hard to say. But you also have to be practicing, though, for at least 3 years. So you won't be audited for at least 3 years. So if you didn't want to write the full portfolio, you do have the option of taking an exam, which is the same exam that they give to hygienists in Alberta and BC, I believe. So it's not an easy exam. It's not extremely hard either, but it's not easy. It's mainly case studies, and you have to actually apply your knowledge. So simply studying from the textbook won't be good enough. You have to learn a lot. But if that's something you were thinking about doing instead of your portfolio, then that's something you could do. And you need to also do a practice profile, which is easy. Or the third option is to take that exam, or have an on-site practice assessment. If the on-site practice assessment is something you're okay to do, in my opinion, that would be a lot more stressful than the practice profile. But if you wanted to do the on-site assessment, that is when somebody from the CDHO actually comes to your office and looks through everything. They look through charts, infection control. They will ask you questions. They will ask other people in your office questions. So to me, that seems kind of intimidating. So I don't know why anybody would want to do the practice assessment, but that's just my opinion, especially since the practice profile is so easy. Like, you just have to be honest. It takes 10 minutes. It's a checklist. That's it, but it's pretty simple. So anyway, I did explain those quickly because I do talk about it a lot more in the portfolio workshop. I believe it's a full hour video that I share about everything, and I explain all of the options. But it's nice now because you do have options. Up until a year ago, we did not have options, and we had to do the portfolio no matter what. And the practice profile used to be called your typical day, which was really, really hard. You had to do a new typical day for every single office you were working in. So for those hygienists who work in 3 offices, they had to do a typical day for all 3 offices, and each typical day was probably 3 pages, 5 pages. It was insane. So things are a lot easier now. So lucky everybody. And I should say, for the exam, there is a fee. It's $125. You do have up to 4 times to pass it. And it's done at home. It's a self-study type, and you could use your book if you wanted to, but I don't see how that would help because it's more of a knowledge case studies types of questions. If this is something you wanted to do, I do offer a prep course on that also if that's something you would like to do. So just let me know. But in my opinion, everybody, I think it's just easier to do the profile and the practice profile, or the portfolio and the practice profile, but that's up to you and I can help you in anything. So just let me know. So yeah, so those are the options you have. And I tell every new hygienist out there, keep organized now. Now is the time. Anytime you take a course, read an article, write everything down, say where you took the course, how long, what day, who taught the course, write everything down so you always have it. Um, Even if you have like a binder or a notebook specific to that, that helps huge, because if you're audited in 3 years, you need to have all of that, because if you don't, you pretty much have to start over. And trust me, that's not easy, because that's what I had to do. I was audited a couple years ago, and admittedly, I was organized a little bit, but not really. And when I was audited, I had to do everything over again because I couldn't find any of my notes. I couldn't find anything. So I pretty much had to start from scratch. And that was a very stressful, anxious year, which is now why I teach in the portfolio workshop, because I know how things can be very, very stressful. But I also know that if you keep organized, oh my goodness, it's so much easier. So that's a common question that I did have about the portfolio. Um, what else? There was another question that somebody asked about the portfolio. Somebody was asking me if you need to have 75 hours over 3 years. Yes, if you do option number one. So if you choose to take the exam, you don't need to have 75 hours over 3 years. If you decide to do option three, the exam and the on site practice assessment, you don't have to have 75 hours over 3 years. But they say to study for the exam, it takes you to study about 75 hours. So I don't know if it would take anybody that long. It could take longer, it could take less. It's hard to say, but 75 hours to study for something does seem like a lot to me. But if you're okay with something like that, then that's something that you should do absolutely. So, enough about the portfolio though. But I will quickly say, I'm sorry, one last thing. If you have to submit your portfolio for the year 2017, it says right here, if your number ends in 4 or 9, you have to submit your portfolio. So have a look, everybody. You should know your number. 4 or 9, then you do have to submit it for 2017. They will be sending you an email or a letter, depending on the options you had checked, if you prefer the email or the mail. So they will send you either one, but you still should know that if your number ends in 4 or 9, you will have to submit your portfolio. But again, enough about that, because we only have 30 minutes. But if anybody does have any questions about their portfolio, please let me know, because it does not have to be as hard as it seems. Your portfolio is now done in what's called the Smile portal, which I do have a form for you all to look through that if you like. I will post the link at the end of the webinar because I have it right here, but it does explain everything about the Smile portal, because this is the system you do have to put your portfolio in now. It explains everything. It shows you pictures. It's awesome. So for those who are a little technical, not sure how to use a computer, or you're technically challenged, so to speak, this will help you. And if you need more help, though, please just let me know. So the next thing that I would like to talk about is, so another question that I had is, how do I write in the chart? Now, this is different a little bit depending on the office you are in. So I would always look at the previous example and see sort of how they wrote things down. I mean, I'm not saying to do it exactly the same, but see their order of, where they put the amount of, plaque, tartar, if they gave oral hygiene instructions, things like that. So I do have a small example for you here. This is what my chart would look like as an example. So NCMH is a short form for no changes medical history. So if I had asked the patient if there's any changes, have they been to the hospital, have they had any surgeries, and they say no, then I say no changes medical history, NCMH. If they had said though, oh yeah, I was in the hospital for a stomach pain November of last year, then instead of saying no changes medical history, there has been a change of course. So you would say patient reports. In fact, if you like, I can write that down. Actually, I'll put it down on the bottom here. You could say patient reports was in the hospital November 2015 for stomach pains, and then you do have to talk a little more about that. So did they find anything? Are they taking any new medication? Are they doing anything differently? So you could say that, so I said here that the patient reports was in the hospital November 2015 for stomach pains. They couldn't find any issues. Patient, so PT is a short form, is not taking any new medications. Taking any new medications. And then you could say, if they said patient has not experienced stomach pain since then. So you do have to be more specific. If you say, there has been a change in the health history, you do have to say why. Because if I simply were to say the patient was in the hospital November 2015 and that's it, well, that's not helping anybody. It's like, well, why were they in the hospital? Did they have a heart attack? Were they just visiting somebody? Did they have a cough? Like you need to ask more questions. So that's just a quick example here. And no CC means no chief concerns, no chief complaint. So if they haven't said their teeth are sore, their teeth hurt or something, then you would say no CC. But if you say to them, do you have any tooth issues? Are your teeth sore? Anything you would like to talk about, ask about? And they say, well, actually, my tooth on the lower left has been sore for a month to hot. Then instead of saying no CC, you would say patient reports tooth on lower left has been sore for the past month to hot. So keep it simple, but at the same time you do have to be specific. So this will tell you that when the dentist comes in to check the teeth, you will have to let them know and, say, Mr. Smith has said that this tooth, the 3-6, has been sore for the past month, so then he would have to look into that more so. And then I talk about if the patient had a lot of plaque, not a lot of plaque, calculus, so I keep this simple. So I just simply said, light plaque and calculus. You could say light plaque localized to the molars, moderate plaque localized to the upper and lower anteriors, heavy calculus lower anteriors, but light calculus generalized, so you could be as specific as you like or as simple as you like to. It is up to you and your office too, because in my office, we don't tend to write a lot, but I tend to write a lot more than some people because I like to be a little more specific. And if you explained anything to your patient or showed the patient anything, make sure to put that in your chart. So if you had shown the patient how to reach their lower anteriors easier, you do have to put that, or should put that in the chart. So then for next time, if you say, oh, I had shown you a new technique, how to reach the lower front teeth easier, did that help? And if they say, yes, thank you so much, or they could say, no, that didn't help at all, so then to try something else. And at the next appointment, if you see there's actually more plaque there than before, then you know to try something else, right? Because that technique could have been too hard for them, which now they have more plaque. So that's obviously not a good thing. So it's always a good idea to write these things down so you know for next time. Even if you're not seeing the patient the next time, it's good to know for the other person too, right? So the next thing that I write down, so OCS stands for oral cancer screening, which I should write that down actually. OCS equals oral cancer screening. And as I've talked about before, you should be doing this on every single person, no matter what. Not only for new patient exams, not only for seniors, on every single person. It will take you 2 minutes. That's it. You just have to look on the inside of the cheek, look on the outside too. Look on the side of the tongue, look under the tongue. It is easy. In fact, see if I can find a quick image for you guys. I do have it on the website somewhere, but I'll see if I can find it because there's an image that I like. In fact, I do have it in my office also, right here. So it shows you exactly. So you should be looking in all of these areas just to make sure that everything's as healthy as possible. So let's say you looked and everything seems to be within the normal limits, then you should put it down right here. So I can write that down too. So WNL stands for within normal limits. If you see something like a lesion, let's say on the underside of the tongue, let's say here, and you think it looks a little bit odd, you could say a lesion noticed, 2 by 2 millimeters, red, under the tongue near the 4-3. It's not sore to the patient. Or if it is sore, then make sure to make a note of that. So if you see something, you have to be as specific as possible. If your office does have an intraoral camera, take a photo of it because that also helps huge. I have people come to me all the time, every single day, and they go, Andrea, can you look at this patient? They have this lesion here. I just want to see if it's normal because I teach oral pathology too, right? So I have seen a lot of different lesions. I have a pretty good idea of what's normal and what's not. Usually things are normal. It's just they don't know what it is, right? So it does help to take an oral pathology course of some kind because you will learn with experience what's normal and what's not. But it's good to take a course initially so you have a good head start because you don't want to be putting lesions in the chart that are normal every single time and the dentist is like, Andrea, these are normal. Like, you really need to take an oral pathology course because you keep on saying things are not normal when they're normal, right? So it's good to have an idea. And then I say that I did a selective mint polish because polish should always be selective. I polish all the teeth everywhere because if I don't, then my patients would think, oh, did you not clean my teeth all the way? But the CDHO says polish should be selective. So only polish teeth that have stains. So again, it depends on your office. They may be okay with that. In my office, if we don't polish a patient, they will say something. Or if we polish every other tooth because there's no stain, then they might go, well, the last hygienist did all my teeth. Why aren't you? And trying to explain selective polish to a patient, they're not going to know what that is and they're not going to care. So, but that's just what I do. So I put that at the end and then I make sure to put all of the codes also. So if there was a checkup, a polish, a scale, and if we took any x-rays, if we did anything else, I put the name. I put the codes and also how much time that I did spend on the polish and the scale. You don't have to put how much time is spent on anything else, really. I think it's just the polish and scale for the most part. I've seen some hygienists do how much time they spent on oral hygiene instruction, on the fluoride as well, but the main things to do is the polish and the scale. So as you can see, I spent a unit, which is 10 minutes or 15, depending on your office. Every office is different, so check with them. And same thing for the scale. I did 1.5 units. So I put the name, I put the code, and the amount of time with the polish and scale. Some also do the time for oral hygiene instruction and for other things too, but it does depend on your office. So look through the chart and just sort of see. And then I made a note. He would like to check up x-rays at the next recall visit to monitor interproximal decay. So this is good to make a note of, because then you know for next time to take the x-rays. Either, 2 or 4, he needs to let you know. Or if another person is seeing the patient next time, then they also know too. And you always have to sign the chart. So I'll say here, sorry, I forgot, always sign the chart. Now they say you should sign your full name. What I do, since I have a specific number for my office, I do 117 because that's my number. And I usually do, well, it depends how much time I have, but I will put down my full name here. Whoops, I'll put down my full name and then my designation, so RRDH. I kind of want to ask the CDHO about this, because I've heard before you have to sign the chart and RDH or RDH, plus you have to put your full name. I don't know. I also don't think it's a huge thing. Like, I don't think you have to worry about it. But at the very least, though, you should put your name and RDH so they know who is the one seeing the patient, right? You could also sign the name if you wanted to, but I don't sign my name. I just put down my full name. Although if I'm doing a filling or things like that on the patient, I do sign as well, but I don't know why I do that. I've never really thought about it. So you know what? I kind of want to ask the CDHO about this, and I'll let you guys know, but I also don't think it's a huge thing. The main thing you have to do is, I'd say, sign your name and put your RDH after that, so they know you're not an assistant, you're not a dentist, you are an RDH. Yeah, you guys, so that sums up the chart. I'm just thinking of the charts that I have in my office, see if I forgot anything. Oh, of course, which I'm sure you all knew this. Make sure to put the date always. If you need to cross something out and rewrite, the correct way to do it is to have one line through the incorrect word, initial that, so I'll say initial that, and write the correct word beside it. Not behind it, not above it, but it has to be beside it. I was just curious. Can I show you guys how to do that on here? Can I cross something out? No, I don't think so. I can show you guys that next time. I wish I could show you on a piece of paper here, but you won't be able to see that since I'm doing a screen share. So if you're not sure how to do this, let me know, but I think this should explain it pretty good. So let's say you had spelled something wrong, or you put something in there you were not supposed to. So let's say you just said, oh, why can't I think of something? Let's say you spelled, I can't think of something. So all you have to do is put a line right here, initial, and then put the correct word after that. So if you're not sure, just let me know, but you'll probably see it in the charts at some point too. But you also have to remember to always initial it, because if you don't, then who's to say that some person didn't just cross it out for the heck of it, right? Who knows? So that's always very important. But charting, those are the basics you should know. Depends on your office, of course, but this will at least help you guys start with that, okay? So I'll leave you with that for now because I think we're over the half an hour point, so sorry about that. But yeah, so I hope that this helped, and I'll be uploading another video next week also. Please keep on sending me your questions, and you should see your questions answered soon. I will see you guys all in the next video.